Welcome back in. Well, lately we've been hearing a lot about measles cases in other states. While we don't have any local cases reported, we wanted to talk about the virus a little bit more. So this afternoon we have two guests with us from the Toledo-Lucas County Health Department, Dr. Lawrence Monger, the new medical director for the health department, and Terri Detano, one of the department's epidemiologists. Thanks for being here today.
Thank you for having us.
Appreciate it. And we were just chatting because we were talking about 5 years since COVID. You started as a contact tracer.
I did, yes, in 2021,
Wow.
yes. I was one of the contact tracers for about a year, and then moved in from contact tracing into epidemiology.
Right.
And now I'm one of their epidemiologists. There's one of three of us in the office.
Wow. And so measles is something that you are keeping an eye on.
Absolutely, we are keeping an eye on measles as well as other infectious diseases that are going around.
A lot of people are talking about measles, though, specifically right now. Seen a lot of cases in Texas.
There have been,
Southwest?
right now, in the United States, there have been about 222 cases. Most of those cases are certainly in Texas because there's been a couple of outbreaks in Texas. And part of that, there are about 38 cases that have been hospitalized as a result of the measles, and 2 deaths, one in Texas and one in New Mexico.
Yeah, when we talk about measles, I think, oh, is it like the chicken pox? Is it like whatever? No, this is a serious virus. Talk a little bit about some of those complications, some of those symptoms.
It absolutely is a serious virus. It's highly contagious. It can stick around in a room 2 hours after someone has been in a room with measles, so it can stick around for quite a while. It's a virus. It causes all the viral symptoms, but after the virus takes hold, you start to develop bumps, measles, red bumps, a couple of days later after all of the viral symptoms come on. But after that, you can get a lot of complications. You can get encephalitis, which is swelling of the brain. You can get pneumonia, infection of the lung. It can cause some amnesia to your immune system. So it attacks the immune system. It attacks the memory cells that help you remember how to fight other viruses, and it partially destroys them. So you can develop all kinds of other infections post-measles. So it can be deadly, and we've already had, like you said, 2 deaths, one in New Mexico, one in Texas. It is a very deadly, highly contagious virus.
Wow, so it is important that we're keeping track of it to help slow that spread. So it's your job to make sure that we all know when, hey, it's coming closer, things like that, right?
Correct. We would receive lab results because what the physician or medical providers are doing are actually taking lab samples and they're sending them off to the lab. And then if a positive case does exist, it will come across our desk because all positive labs of infectious disease come into the health department. So we would see that, and then it would be our role to reach out to the person that has it. And if it's a child, we would certainly, of course, be addressing it with the parents, and we literally will tell them when the contagious period started, which is usually 4 days prior to the actual rash onset to 4 days after. So you can see there's an 8-day span where that's where you're most contagious. And if you don't have the rash early on in the disease, like Dr. Monger had referred to, and you're just feverish and those kinds of symptoms, and then you start to get the rash, you can see 4 days have already gone by where you were spreading that virus to others in the household or in the school building or wherever in the workplace.
Yeah, so that contact tracing there, it's
very
important so everybody knows, hey, you may have been exposed if you're traveling from out of state or out of the country, different places. So clearly one of the biggest tools that we have to fight this and to slow that spread is the vaccine, correct?
Absolutely. Vaccination is the way to prevent this. A single vaccination, you're about 92 to 93% protected against measles. If you get both vaccines, first at 12 months, the second one at age 4 to 6, you're 98% you're protected against getting it. So it's highly effective, and even you can still get measles after you've had both vaccinations, but it's going to be a very mild case. So incredibly important to have had those 2 vaccines growing up, and then there's lots of other ways to figure out if you haven't had those 2 to catch up and get a booster vaccine down the road if you haven't had those 2 initial vaccinations. So.
And there is some hesitancy out there, and I think we hear that, from parents. Well, is it going to lead to autism or other things? But it's proven to be a safe vaccine.
It's proven to be very safe, very effective. There's lots of studies have looked at this whole idea of autism and that vaccine causing it, and it has been found that there's no connection between the two. And it is the way to prevent this from spreading, the only way. I think there's some data out there about what percentages of people in Lucas County have.
Yes. In Lucas County, we found that there are about 74% of the population or children have had the MMR vaccine, both doses. But that's still, I mean, again, you need at least 98% to have herd immunity, within the geographic location. So we're far beneath where we should be as far as vaccines should be given to kids. So when we look at that data, then the chances of it spreading, from one case to many cases is even that much more greater.
Have we always kind of been around that 75, or has that gone down in recent years?
I think it's been probably around that area for some time. It's not always been like that. So if you look at the historical of the MMR vaccine, we actually licensed for the vaccine in 1963. So once people started to get vaccinated, the rates of measles started to drop, of course. Then in the 80s, late 80s, they decided, you know what, we think that 2 vaccines is really necessary in order to prevent any additional cases. So then 2 vaccines, or 2 parts of the MMR, were actually introduced. And then in the year of 2000, the measles was almost eliminated in the United States, right? Well, over the course of those years, since 2000, what you're finding is less and less people are becoming vaccinated. And as a result, some of these infectious diseases like measles are reemerging. And that's what we're seeing now.
So now is the time, maybe check your kid's schedule, check your records, and see if you need to get into the doctor and take care of that. But good to have this information, because a lot of people are talking about it right now. So we appreciate you being here today.
Thank you so much.
Thank you. Appreciate it.